Hello, ladies and gentlemen. Welcome to this edition of the Cameroon Town Hall for Healthcare Professionals. My name is Elvis. I'll be co-moderating this session with Dr. Brian Tegomo and, of course, our chair, Dr. Muno Ken. If you're attending for the first time, this is the platform that brings together healthcare professionals of Cameroon origin spread across 37 countries as of today. Our membership has grown up to 2,700 members. This is 5 years in existence, and we've never skipped a session. We come here every once a month now to discuss on how we can contribute in the amelioration of the healthcare system in Cameroon. Today, we are very excited that we shall be bringing medical students in Cameroon to talk about their initiative that has existed for more than 23 years of today. I'll be co-moderating this session, like I said, with Brian Tegomo and Muno. Hello, Brian. Welcome to this session. And how do you feel about today?
Yeah, thanks, Mona. Thanks a lot, Elvis. It's a great honor. I remember the early days of the Cameroon Town Hall when healthcare professionals and experts across the diaspora came together with their expertise in different fields to help improve the health situation in Cameroon at the time. So it's really amazing to see how much the platform has grown and the contribution that has been made to advance healthcare, public health, global health security, not only in Cameroon, but also the effect that it has had across Africa and across the globe. And we have been honored to see that this model has been replicated as well in other countries as well, like India. There was someone who came here from India and was really impressed and decided to go back and start a similar initiative. So it's really a great honor. I'm really honored to see that we have with us the Minister of Health for this very particular session where we will be receiving the Cameroon Medical Student Association. So it's an honor. Over to you, Elvis. Thank you.
Thank you very much, Brian. It's always an honor to co-moderate this session with you, and thank you for being here from the very start till today. And of course, let me pass over to our own chair and the founder, Dr. Muno Ken. Hello, Dr. Ken.
Yeah, thank you very much, and merci beaucoup, Elvis, and thanks for uh, putting this together also. And I'm really pleased to, and I'm honored to have the Minister of Public Health here today. It's always a pleasure, and we're grateful that you could make it and surprise us in this session. And we want to also thank you for the help you've had and given to the diaspora in particular in order to be able to uh, influence health in Cameroon. And I would love to thank you. Recently, the doctors in the Americas were in Cameroon, and you had to give us your full support and in our medical outreach, which we did. And this also was facilitated through the town hall and for everything. And I think we are very grateful that you have always come here and be open to answering questions genuinely and to see how we can progress health in Cameroon. So thank you, everyone. Thank you, Elvis. Thanks, Brian. And also, I would love to acknowledge that the students right now, some of them have some internet, so they're all in the same area. So there are more than 100 of them sitting in the amphitheater. So actually, the numbers may not reflect the number of students that are actually locked in right now and willing to share their experience of what they have done as healthcare professionals, including pharmacists, physician students, laboratory students, and also medical students, so dentistry students. So this is a huge platform for them to tell us what they have been doing and what other students can also do in order to foster healthcare in Cameroon. Over to you, Elvis.
Thank you very much, Muno. And if you're attending for the first time, this is the Cameroon Town Hall for Healthcare Professionals, a platform where we meet once a month to discuss on how we can ameliorate the healthcare system in Cameroon. If you would notice, we always, at the end of this session, have a YouTube link which we share with those who were not able to attend this session to be able to see and listen to the conversations that we had. Right now, the session is being streamed live on Facebook as well for those who are unable to join using our YouTube link. Know that each session of the town hall is always viewed by more than 3,000 people based on the stream and data that we have for historically over the past 5 years. Today's town hall shall be receiving the Cameroon English-speaking Medical Student Association, CAMESA, a student-led national association founded in 1993, bringing together English-speaking students across Cameroon's medical, pharmacy, dentistry, biomedical science, nursing, medical laboratory science programs. For over 3 decades, CAMESA has built a powerful tradition of unity, mentorship, public health education, and community service. Its annual health campaign started in 2003 and has now run for 22 years, reaching 28 health districts, touching more than 25,000 lives. So even indirectly, we can say about 120 lives have been touched through sensitization. In their most recent Bambutus campaign, more than 100 young medics and health professionals provided free consultations, medicine, lab tests, dental care, cervical cancer screening, health education, counseling, surgical support, directly serving 826 people across multiple health districts in Bambutus. This is the kind of student leadership Cameroon needs. Young health professionals not waiting for the future to serve, but already bringing healthcare closer to our communities. Today, we are also deeply honored by the presence of His Excellency the Minister of Public Health of Cameroon, Dr. Manauda Malachi, who will give the opening remarks for this session. Your Excellency, your presence here today is not new to us. You have been a regular in the town hall. This is your 4th time joining the Cameroon Town Hall for Healthcare Professionals. And over the years, you have become a friend to the diaspora, a friend to medical students, a friend to healthcare professionals of Cameroonian origin around the world. Our town hall has existed for more than 5 years, now bringing over 2,700 healthcare professionals across 37 countries. So, Mr. Minister, by showing up again and again for this platform, you have shown respect for this global Cameroonian health community and for the students who represent the future of our healthcare system. We are honored to welcome you, and at this time, I have the privilege of inviting you to officially open this session and give your opening remarks. Thank you once again for coming.
Merci beaucoup. Je ne sais pas si je me fais entendre. En tout cas, je voudrais tout d'abord féliciter les organisateurs du Cameroon Town Hall for Healthcare Professional pour avoir maintenu sans interruption durant 5 ans, comme je l'ai appris tout de suite, durant 5 ans, cette remarquable plateforme d'échange et de partage entre les professionnels de santé camerounais en tant qu'au pays ou à l'extérieur pour pouvoir faire avancer leur système de santé. Je tiens également à dire merci à vous, Monsieur Elvis, qui avez eu l'amabilité et l'amitié de m'inviter régulièrement à cette plateforme pour que je puisse dire un mot, écouter également, apprendre, n'est-ce pas, des uns et des autres pour que nous puissions moderniser notre système de santé. Je salue chaleureusement aussi, comme ça, les étudiants qui ont présenté leur initiative aujourd'hui. Vous avez démontré que le leadership en santé ne commence pas par l'obtention d'un diplôme, mais dès lors que l'on décide, n'est-ce pas, de mettre ces connaissances au service de la communauté, de votre pays. Le Cameroun fait face à d'importants défis sanitaires, vous le savez très bien, les maladies transmissibles, les maladies non transmissibles, les épidémies émergentes, les ressources financières qui sont de plus en plus limitées. Nous avons autant de défis dans notre pays. Et dans ce contexte, donc, votre engagement communautaire, votre créativité, votre volonté de servir constituent des atouts précieux, n'est-ce pas, pour notre système de santé. Et chaque activité de sensibilisation, chaque campagne de dépistage, chaque action menée dans une communauté contribue à sauver des vies et à rapprocher les services de santé de nos populations. Vous êtes donc non seulement l'avenir de notre système de santé, mais déjà l'un de ces acteurs, n'est-ce pas, dans tout ce que vous avez fait désormais. Et le gouvernement, sous la très haute impulsion de Monsieur le Président de la République, son Excellence Paul Biya, poursuit la modernisation de notre système de santé à travers le renforcement d'un certain nombre de services sur lesquels je voudrais revenir après parce que nous construisons ainsi la résilience, n'est-ce pas, de notre système avec votre engagement qui s'inscrit pleinement dans cette démarche. Et je voudrais donc inviter également nos universités, nos partenaires techniques et financiers, les associations professionnelles, la diaspora à accompagner davantage cette jeunesse qui ose, cette jeunesse qui voudrait, n'est-ce pas, contribuer à sa manière à notre système de santé. Et le meilleur investissement que nous puissions faire pour notre système de santé, c'est lui que nous faisons aujourd'hui en faveur de nos futurs professionnels. Before I conclude my remarks, I would like to make, three comments before you. First, I would like to officially congratulate the Cameroon English-speaking Medical Students Association, COMESA, and all the students actively engaged in community health initiatives. Your dedication and commitment are exemplary, and you are already making a mindful contribution to improving the health of our communities. Second, I'm pleased to announce the establishment of the Minister of Public Health Annual Community Health Innovation Awards. Beginning in 2027, the most outstanding students-led initiatives addressing Cameroon's national health priorities will be recognized by the Ministry of Public Health and will benefit from technical support, mentorship, and linkage with our development partners to facilitate their growth and sustainability. Third, I'm instructing my technical services to work closely with COMESA and the organizer of the Cameroon Town Hall for healthcare professionals to establish a sustainable collaboration framework that will enable student-led initiatives to contribute more effectively to our national programs in disease prevention, health promotion, disease surveillance, and primary health care. And dear students, never underestimate the impact of your commitment. Every child protected, every pregnant woman educated, every person screened, and every community better informed represents a victory for our health system. Allow me to say some progress we made in our health system. Premièrement, nous avons ces dernières années renforcé les infrastructures sanitaires. Vous allez voir les hôpitaux de référence qui existent aujourd'hui dans les 10 régions, les plateaux techniques qui sont également en amélioration. Vous avez, par exemple, aujourd'hui, l'IRM un peu partout dans les 10 régions. Vous avez une IRM, vous avez des scanners jusqu'aux hôpitaux, à certains hôpitaux de district. Vous avez des radios, vous avez un certain nombre d'équipements. Et sur ce point, je voudrais également annoncer ici notre disposition à faciliter, n'est-ce pas, tout ce qui arrive au Cameroun en termes d'équipements sanitaires. Donc, si vous avez, vous qui êtes de la diaspora, des équipements à faire rentrer au Cameroun, sur le plan sanitaire, nous allons nous mettre en cadre pour pouvoir vous faciliter les taxes douanières, tout ce qui est fiscalité, tout ce qui est procédure douanière, exonération et tout le reste auprès du ministère des Finances. Nous avons également la couverture santé universelle aujourd'hui qui nous a permis, n'est-ce pas, de mettre un accent particulier sur nos mamans qui ont des enfants, les petits-enfants et tout le reste. Et je voudrais, comme vous l'avez également compris, vous annoncer que le Cameroun, entre 2022 et 2024, a diminué de 63% le taux de décès maternel. Nous sommes passés de pratiquement 758 à aujourd'hui 258 et nous sommes toujours en progression pour que nous puissions maîtriser, n'est-ce pas, ces décès maternels et infantiles. Les enfants qui mouraient de paludisme, aujourd'hui, on a diminué de moitié en réalité. Et vous verrez que l'introduction du vaccin contre le paludisme nous a permis également de maîtriser la situation. Le taux de couverture avance et nous, les grandes maladies comme les maladies non transmissibles, comme les cancers, l'hypertension, le diabète, sont prises en compte et nous sommes en train de travailler là-dessus. Les maladies tropicales négligées, les 3 programmes, à savoir le VIH, la tuberculose, le paludisme, même les hépatites, aujourd'hui, nous sommes en train de faire des efforts pour pouvoir les maîtriser. Autre chose, c'est nous sommes dans une démarche de transformation numérique de notre système de santé. Et un ensemble de projets sont en cours aujourd'hui dans le cadre de dossier médical, électronique du patient et tout le reste. Nous sommes en train de le faire et nous valorisons également les ressources humaines en santé. Mais comme je vous l'ai dit, des défis existent. Et donc, vraiment, je pense que notre conviction, c'est que nous pouvons traiter les maladies, nous pouvons les éviter également, mais nous ne pouvons pas le faire seuls. Nous avons besoin de vous, nous avons besoin de votre expertise, de votre expérience, de votre contribution. Étudiants, professionnels, nous devons tous ensemble transformer notre système de santé pour que demain, lorsque nous aurions passé la main, que ceux qui arrivent puissent continuer là où nous avons laissé. Voilà à peu près ce que je voudrais dire à l'entame de notre session de ce soir. Et je voudrais encore vous dire merci pour m'avoir invité, pour m'avoir permis, n'est-ce pas, de vous grignoter quelques temps de discussion. Je vous remercie, que Dieu vous bénisse tous.
Merci beaucoup.
Merci beaucoup, Excellence. Thank you very much. We are always very proud and thrilled to have you on the session. Pass it over to Brian. Brian, votre commentaire par rapport à mot d'introduction de l'Excellence.
I just want to thank His Excellency for the initiatives, particularly the community awards initiative that he's initiating. Such an honor, and thank you so much for recognizing the work that the town hall is doing. And thanks a lot, Your Excellency, for all the work that you've done. Cameroon is in a better place in healthcare today because of your leadership, because of your contribution. So thank you so much, and we are really honored to have you.
Thank you, Brian. And Mona, you heard the minister's comment about how much work that we have been able to achieve over the past years in reducing maternal mortality. I want to get your comments about the minister's word of introduction before we get to the guests today to give their presentation.
Yeah, Elvis, thank you very much. And I've been listening very keenly to the minister, and I just want to say felicitation for all what you've been doing and for your willingness to also be present publicly and be able to both answer questions and facilitate the diaspora. I have been a beneficiary of that multiple times, and it's something which people in the diaspora recently, the Cameroonian physicians in the Americas were in Cameroon for a health mission in Boya, and you made it possible for us to get that done, and you facilitated things. And my organization, which I'm still part of, was very delighted. They had a different feel of what it means to go back home and give back. So a lot of them, I just posted, no one knew you were coming, but I posted in the forum, many will be joining, and they were very excited. And next month, our president will be in Cameroon to try to see you, but it's also very important that all what you've done in terms of reducing maternal mortality, in terms of providing access to care, providing the necessary equipment that are needed. I'm an oncologist. In order for us to be able to treat cancers in all the 10 regions, in able to do imaging, and in able to reduce mortality in terms of maternal mortality, child mortality. So it's a work in progress, and we in the diaspora, we are here to assist. I don't want to always use the word. We are here to assist the government and also show that we have a lot of professionals that could be of help. And I'm also pleading on those who are in the diaspora to know that there is a lot of work going on in Cameroon. We can learn. It's always a two-way street. Once you go to Cameroon, we learn. Last time the team I took over to Cameroon, they learned how competent your surgeons were, and just understood that by coming from the diaspora, they can make everyone build a better team in order for us to be able to do complex oncological surgeries. That was what we did. So you had a very competent team in place, and we just want to be able to be part of that structure in the diaspora. So thank you very much. Thanks for your time. Thanks for being here. So Elvis, my remarks may keep going on, but I
I
want to
know.
stop here. But
Yeah, thank you very much, Chair, and thank you for your leadership. Thank you for keeping the town hall together for these past 5 years. The minister also mentioned in his remarks that he will be facilitating diasporans who have access to medical equipment that could be of use to improve the healthcare system in Cameroon. I want to call Dr. Kenji, who is the director of the of laboratories at Stanford Health, to maybe just make some remarks, because I know in your field there's always a need for really complex equipment to be sent home, including genetic sequencing machines, which are very expensive but complex. And I know you always have access to some of this equipment. What do you think about the minister's promise to facilitate this and up to the level of obtaining exoneration?
Thank you so much, Elvis. Thank you so much, Your Excellency, for being here. This really means a lot to us. Being able to send these equipments without any issues from custom is great. You know, as you were saying, I currently have a Cepheid instrument in my garage. It's one of those instruments that we retired from Stanford. It still works very well. And myself and Ezra have been figuring out what can we do with it. It's a Cepheid instrument that has like almost 8 towers. So these are things that we have access to, but being able to send it back home, we are always just struggling with the issues of custom. So I think just being able now to have, a structure where we can send off some of these things. Again, the ministry can decide what they want to do with it, but we have some of these from our big hospitals here that we no longer use that, I think this platform will be very helpful for us to send them back home so that they can use them back home and also see how we can get the reagents. So thank you so much, Your Excellency, for thinking ahead for that. Thank you to Elvis for the opportunity.
No, thank you very much, Kenji. You've been one of the great supporters of the town hall, and we really appreciate all the help you've been providing, both as a contributor, a guest speaker, but also a friend to the Cameroon Town Hall. Now, of course, I know that we are not only talking about diaspora. The town hall constitutes of also those who are back home, and we've had a lot of people back home who have really made the town hall what it is today. But of course, the minister does not work alone. He has collaborators who work with him to make sure that this really excellent work they are doing to improve the healthcare system in Cameroon is successful. And today, I think we have as guest the the permanent secretary of the National HIV Program, Dr. Fokam, who is online. Hello, Doctor. You have been a guest speaker in the town hall, and you have been a member of the town hall as well. What are your comments as far as the minister's introductory remarks are concerned before we hand over to Kamesa?
Thank you very much, Dr. Dancy and Big Brother. I really want to extend my regards to all of those present today, and also to express my appreciation to what the minister has been doing with us. I must confess, I'm one of the main product working with the minister. He chose us as the younger generation to contribute in his vision, and this vision actually is quite being perceptible at the country level. And we also believe with this collaboration with the town hall, it is very, very promising. It is extremely productive for the country. And one comment I would like to make before wrapping up also is to see how possible being also biomedic based, if there is really any equipment in that line, I will be personally committed to see how I can assist alongside your effort to make sure our Directorate of Health Operations can quickly fast track all the process for exoneration. Then maybe one last comment is Town Hall is really has been a great initiative during COVID-19. Now COVID is over, but the program still keeps on going. I think it is high time for us to see how even just a position paper could be done on Town Hall and really disseminate this best practice that could also help many other countries. Thank you. Over.
Thank you so much, Dr. Fokam, for always being part of us. And the last person before Kamesa will be Professor Sokwe. Any last word from you about the minister's opening remarks before we hand over to the student?
Okay, thank you very much for giving me the floor. Tu peux couper ça. Voilà. Oh,
okay, yes, we are in the same room with the minister, as you can see, and it's an honor to be with you this evening and with the minister. Just to say, as Dr. Fokam said, it's an opportunity for us to contribute to the healthcare system with our current minister, who has really valued the human resources, the local human resources, and he has given us the opportunity to contribute. And we have very frequent discussions, open discussions. We can say when we do not agree with him, and he will be very open and very happy to hear about what we are not agreeing with. And these are the reasons why we really think it's an opportunity, and your association should really seize this opportunity to contribute the best they can. Because it is not a dogmatism. You will certainly have ideas that are not the same that we have here, but this can help actually building something that can fast track the development of our healthcare system. Just to indicate, as the minister said, rightly said, he cannot count the number of people who have obtained those facilitations in terms of custom duties that were exonerated. And there are a lot of things that have been done and that he is not reporting here. But when you come to Cameroon, just go in all the 10 regions and see the difference now. In each of the 10 regions, there's a real difference in terms of healthcare, healthcare system. Other thing is about the health districts. We used to have about 150, but now it's almost 220, because he's trying to make sure that the healthcare system goes across and reaches the people wherever they are. And to date, it's about 89% of the population that are less than 60 minutes away from a healthcare center in Cameroon. 89% of the population. It's a huge and massive difference. It used to be like 60%. So that's all what I will say for a start, and thanking you again for giving me the floor. Yeah.
Thank you so much, Professor Eugene, for all the work you're doing and for all the effort you're putting to help the minister in his accomplish his mission. Thank you very much once again for showing up to this session. If you are attending for the first time, this is the Cameroon Town Hall for Healthcare Professionals. We meet once a month to see how we can contribute in the amelioration of the healthcare system in Cameroon. Now is the time for me to pass it over to Kamesa. As you heard from our chair, they are all gathered in one amphitheater because they had internet issue, disconnection with MTN, and they decided to regroup in one hall where they will be doing their presentation. And we want to pass over the floor to them and listen to them, listen to what they have to do. They have done this before last year. I remember when they were planning to go to Bamboo Tools, the Cameroon Town Hall for Healthcare Professionals supported them with $1 million francs. And so they need our support, and we want to listen to what they have to do and to see how we can be part of their initiative. Over to you, Kamesa. Do you have access to share your screen if you want to?
Yes. So we would like to know who will be presenting for CAMESA.
Is it Lamuela? Mono, you want to give her the hosting right to share her screen?
Yes, she has, but she's muted, so.
Lamuela, you want to unmute? We can see your screen now. So you want to unmute?
Can you hear me now?
Yes.
Yes, we can.
Oh, thank you so much. Good evening to His Excellency. Good evening to everyone, all protocol duly respected. I am Lamuela Chin, a proud, fresh Kamesa alum, and I'm humbled to have the privilege to give this presentation. I'll go straight to the point. Tonight, I would really like to take you on a journey. We'll look at who Kamesa is, what we've built over the 3 decades, and why 2026 represents our most ambitious and most important campaign yet. By the end of this evening, I hope you'll not just live informed, but move to acts, for your partnership is vital. Um, For tonight's presentation, it's organized into 4 sections. First, we'll cover who CAMESA is, our identity, our mission, and how we're structured. Second, we'll walk through 30 years of impact, the milestones, the campaigns, and the legacy we've built together. Third, we'll dive into the centerpiece of the evening, which is the 2026 Nguti Health Campaign, what it is, who it serves, and how it works. And finally, we'll talk about the partnership opportunity that we're asking for and what that investment makes possible. I'll keep things moving and we'll have time for questions in the end. Before we can talk about what CAMESA does, you need to understand what CAMESA is.
If your slide is changing, Lamuela, just to interrupt you, if your slide is changing, we are still seeing your slide number 1.
Oh, that's unfortunate. Give me 1 second, please.
You want to move? Just try to see if you can go to slide 2 and back, just so you are sure about your slide movements.
Okay. 1 second.
Okay, yes. Now we can see your today's agenda.
Okay.
Okay, yes. It's working now. Go ahead.
Okay. I hope you can see me.
Yes.
And hear me.
Yes, we can see and hear you.
Okay, good. Thank you so much. So I was talking about today's agenda, saying it's organized into 4 sections. We'll cover who CAMESA is, our identity, our mission, and how we're structured. Then we'll walk through 30 years of impact, all our milestones, the campaigns, and the legacy we've built together. And thirdly, we'll dive into the centerpiece of the evening, which is our 2026 Nguti Health Campaign, what it is, who it serves, and how it works. And finally, we'll talk about the partnership opportunity, what we're asking for, and what that investment makes possible. And we'll have time for questions in the end. Of course, I'll keep moving. Before we can talk about what CAMESA does, you need to understand what CAMESA is. It's not just a generic NGO. It's not an external charity parachuting into communities it doesn't understand. CAMESA is us, the students, the doctors, and the alumni from the English-speaking community of Cameroon serving our own people. Allow me to introduce you. CAMESA stands for the Cameroon English-Speaking Medical Students Association. We were founded in 1993 in Yaoundé, born from the need to convene as English-speaking medical students in a strange environment and a new language. We have grown into a recognized non-profit and an apolitical association. Our motto, Unity, Solidarity, Progress, is not decorative. It's the operating principle that has held this association together for 30 plus years. To take note, our objectives are clear. We promote cooperation between medical students. We encourage excellence in medical studies. We educate communities on health matters. We conduct philanthropic activities and we provide mutual support to every single member. These are not our aspirations. These are things that we actually do every year in every field. One of the questions well-wishers and investors and partners rightly ask is, how is this organization run? Who is accountable? CAMESA has a formal, constitutionally defined governance structure. At the top is the General Assembly. Every registered member has a voice and a vote. The General Assembly approves all major projects, it elects officers, and can hold leadership to account. The day-to-day governance of the association sits with the Executive Council. We have a president, a vice president, secretary generals, who are the pillars of the association, might I add. We have public relations officers, we have financial officers. Elections are held annually in November by a secret ballot and overseas by an independent electoral committee. All our financial transactions require the sign off of three people: the president, the treasurer, and the financial secretary. No funds move on one person's say so. It's not a personal project, it's an institution with proper checks in place. CAMESA is more than a campaign. The next slideshow will tell us what we do for the other 11 months of the year. Every month, we hold a General Assembly. Our members gather, they deliberate, and they hold leadership accountable. That is our foundation. We also run academic tutorials because we believe excellence in the classroom and service in the community go hand in hand. Our sensitizations and mini campaigns at schools and hospitals take health education directly to the public. We equally make philanthropic visits to orphanages, to nursing homes, and to prisons, not because it is required, but because a medical student who has only seen patients in the hospital has not yet seen the full picture. And we play. We play all the time. Sports mornings, excursions, cultural days, because that's what makes Hamesa a home, not just an organization. For 12 months of the year, this is who we are. In our 30 years, CAMESA has grown from a small group of students to a network that deploys more than 100 medical personnel per campaign and reaches over 1,000 beneficiaries in a single week. We serve communities across the northwest and southwest regions of Cameroon, regions that have faced enormous healthcare pressures, compounded by recent years' displacements and insecurities, which have also pushed us to nearby localities of the west and the littoral where our IDPs are. But the number I want you to hold on to is this. In the room right now are alumni of CAMESA, people who were once students, people who went on to become doctors, specialists, pharmacists, and professionals. You are living proof that this association produces excellence. And tonight, we are asking you to invest in the next generation of excellence and the communities that they serve. So that's who we are. I would now like to briefly look at how the association has evolved over the years. Bear in mind that most of this is oral history and may not be very accurate. The alumni here present are invited to chip in during the conversation. CAMESA, as like Dr. Elvis said, was founded in 1993 with a simple but powerful belief that medical students from English-speaking community of Cameroon could and should serve their communities, not after graduation, not one day, but now. Our first community health campaign launched in 2003 in the Northwest region, precisely in the Pinyin Health District. Those were our modest beginnings, but they established something crucial: relationships. Those relationships with district officers, with community leaders, with the populations we serve have never broken. In 2006, 2011, we ratified a formal constitution and formalized our governance. We were no longer a student club with good intentions, we were a structured association with accountability system. And in that 2006, we had expanded to the Southwest region, starting from the Meme division. And by this time, our campaigns were already multi-specialist, offering dental, sometimes ophthalmological and general medicine services in communities where these were just simply unavailable. The second decade was defined by growth in scale, in specialization, and in the depth of our partnerships. By 2011, our campaign personnel had grown past 80. We introduced surgical interventions for the first times, I think, going beyond consultations and screening to actually operating on patients who had no other path to surgical care. Between 2014 and 2016, we expanded our laboratory screening program. Patients were now being tested for malaria, for HIV and AIDS, for STIs, diabetes, typhoid, and sickle cell anemia, all free of charge, all in communities where the nearest capable facility might be hours away. In 2017, we formalized a partnership with the Aja Cameroon Eye Institute, bringing specialized ophthalmological care to campaign communities. And by 2018, Ascovim surgical team became a core of our campaign structure. Even as the Northwest and Southwest regions faced severe insecurity between 2016 and 2020, CAMESA continued to operate. Our alumni fundraising also became more formalized during this period because of the concomitant commitment of people like you in this room is what has kept us going. The most recent chapter of CAMESA's history is defined by two things: resilience and a deepened focus on the most vulnerable. In 2019, we formally extended our campaign scope to include IDPs, starting from the Mungo division in the littoral, where CAMESA made a deliberate decision to go to them under the leaderships of Dr. Sode Fofang and Dr. Ngoleneri, where we offered our services to over 1,200 people on site. Between 2022 and 2023, we integrated sanitation improvement projects and introduced cervical cancer screening into our health education work, partnering with GeekMed and other associations, responding to what communities had told us they needed the most. In 2024, we formalized our scout trip methodology. Only 4 pre-campaign visits every year to assess facilities, to train local health workers to prepare the communities before a single piece of equipment was loaded onto a bus. And in 2025, 24, during our 30th year anniversary, we deployed more than 120 people and reached over 1,000 beneficiaries in a single campaign. And we maintained all those active partnerships with over 3 specialist organizations simultaneously. And that is where we still stand today. Over 30 years of CAMESA's work distilled into numbers. We've had over 20 campaigns delivered, over 28,000 patients seen cumulatively. We've had 5 specialist partner organizations. We've had ASCOVIM, headed by the eminent Dr. Bwele, who have never failed to respond to our surgical calls. We've had GeekMed, we've had Chai Foundation, who have handled breast and cervical cancer screenings intermittently over the years. We've had Gifted Mob, and now recently the Cameroon Town Hall, where every year we manage to transport, to lodge, to feed about 120 personnel per campaign. We've served 4 regions with 6 or more distinct medical services offered at each campaign. These numbers are not projections. They are the results of 21 years of students and alumni deciding year after year to show up. And now 2026 is the year we go further. Of course, CAMESA does not do this work alone, and we are very proud of that. Effective community health is not a solo act, it's a system. Presented here is a non-exhaustive list of our most recent partnerships. We've had district medical officers provide regulatory access, all the local coordination and community relationships that make campaigns logistically possible. As I mentioned, ASCOVIM, that brings specialist surgical capacity that would have been out of reach for most communities. The Child Foundation that provides us with extensive medication and screening tools. Mahad provides heart care. And of course, we cannot forget the local community leaders who always help mobilize beneficiaries.
We have an internet glitch, but I'm sure Lamuela will be back. Quite an eloquent presenter. We hope
Yes.
the internet will permit her to come back. Lamuela is trying to get connected.
Faculty of Medicine and Biomedical Sciences of the University of Yaoundé, one which always provides student volunteers and academic.
We lost the presentation, but I know Muno is one of the alumni of CAMESA. And Muno, I know you have been an executive member of CAMESA at some point in time when you were a medical student. Can you cover up for this moment of why Lamuela is struggling to get back her slide on, to tell us how you were able to do some of these outreach campaigns? Lamuela, once you're back, let us know.
All right. I think Lamuela is back. She's quite an eloquent presenter, and she has really highlighted the things CAMESA was all about. Yes, I used to be one of the students who was very passionate about CAMESA. And
try to put back your slide on screen, Lamuela. We're just covering for this time, so you get back your slide on the screen. Yes, Mona.
And the faculty has many associations, and CAMESA just being one of them. It's a highlight to show how students are able to, right from training back home in Cameroon, they are able to influence healthcare. They are able to see the need and try to position themselves not just as future trained doctors, dentists, and pharmacists and nurses, but they are able to go into their communities and see exactly how healthcare in the community can shape their lives in future. So I used to be part of CAMESA. I used to be part of Association des étudiants de l'Ouest, which these were things which we did from day to day, and we influenced a lot of healthcare. So without taking your shine, Dr. Chin, I want you to continue your presentation.
Yes, we're waiting for your slide,
Thank you
Dr.
so much,
Lamuela.
Doctor. I am trying to get them on. It's the network isn't allowing us today.
And Jaji Madina, we are enjoying your video and we are seeing the students that are in the hall. Can you put your video on? We continue to see all the students that are in the hall. I see more than 100 students in that amphitheater. And let me bring your picture to spotlight while, okay, that's fine. We can continue. We'll see the students afterward.
Thank you so much, Doctor. I'm really sorry.
That's fine.
Um, So, as I was saying, the 2026 Nguti Health Campaign will run from August 9th to 16th this year of 2026. The location is the Nguti Health District in the Kope Maningoba Division, a historically underserved area with extremely limited healthcare infrastructure. Our target population, by God's grace, is approximately 1,500 people, with a specific focus on the internally displaced people who have fled conflict and have almost no access to specialized medical care. Our team, we hope, would be more than 120 strong, comprised of medical doctors, specialists, nurses, pharmacists, laboratory scientists, dental surgeons, and medical students, whom will all work together for the next 7 days. I'd like to be very specific about what happens on ground during campaign week. Every single beneficiary has access to free general medicine consultations. Dental surgeons perform procedures that many of these patients have never had access to in their entire lives. We might have ophthalmologists who will conduct eye examinations and provide corrective support. Our laboratory scientists run screening tests for malaria, for STIs, diabetes, typhoid, and the rest. Surgical interventions are carried out by ASCOVIM and CIAMAX teams for cases that require it, and medications are administered and dispensed to every single patient that needs them. So, to be clear, for many of the 1,500 people who will be seen in August, this campaign is not just supplementary healthcare. It might be the first time some people are seeing a specialist in their lifetime. So, alongside clinical care, every single day of the campaign includes structured healthcare education sessions for the communities. We'll cut across topics like personal hygiene and hand washing, sanitation and water safety, HIV/AIDS prevention, sickle cell anemia management, cervical cancer screenings and awareness, and also child nutrition. One might ask, why does education matter as much as treatment? It's because treatment assesses today's illness, while education prevents tomorrow's. When the mother understands how cholera spreads, she protects her family for years, for not just a week. But when a young woman knows the signs of cervical cancer, she can see screening before it's too late. The knowledge we leave behind is as valuable as the drugs we bring. Here's what separates CAMESA's model from a typical medical outreach. We did not arrive in August cold. We've been preparing for this since January. We had a first scout trip in January that assessed the facilities and open dialogue with community leaders. A second in March that reviewed the infrastructure, obtained administrative authorization, and prioritized the most urgent needs of the community. In May, we sensitized the community and began registrations. And a fourth scout trip in July will confirm logistics and finalize the supply chain. Only then, after these at least 4 dedicated preparatory visits, do we deploy the full team in August. This methodology ensures that there is zero wastage of resources. It means our communities are ready. It means our team knows exactly what they're walking into, and it means that our week of care will be delivered with maximum impact. Our team for the 2026 Nguti campaign will include more than 20 medical doctors, over 5 specialist surgeons, 10 dental surgeons, at least 2 ophthalmologists, more than 8 pharmacists, 10 laboratory scientists, more than 20 nurses and midwives, and over 40 medical students. One question we always hear is, what happens after the week is over? Does the impact last? The answer I'd like to say is yes, and here's how. We build lasting partnerships with the DMOs, local health structures, so that care continues in some form after our team leaves. We engage community leaders as health champions who carry the message throughout the year. We equip residents with health knowledge and hygiene practices that persist independently. And we return year after year, building on what we've established the year before. A Kamesa campaign is not a one in a long story of commitment to the community, and every year our story gets deeper. Now, let's talk about why we're all here tonight. Mesa has the partners and the 20 years of proven. This is where you come in. The total budget for the 2026 Guti Health campaign is set at 10,872,975 francs. Kamesa
We have.
Again. 1 second.
Okay, Lamuela, now that your slide went off again, if you have the slides, your voice is very, really beautiful and everything is clear. We can hear you without the slides, so you wrap up your presentation.
Okay, thank you. One
We can see the slides.
second.
We can see the slides now.
Is it better?
Yes.
Okay, thank God. So, as I was saying, we are not asking you to contribute everything. We're asking you to close a gap. The funding required from you is the remaining 7,872,975 francs. Every franc of this will go directly to the campaign, to the medical supplies, the personnel, logistics, the laboratory reagents, the transport, and the final scout trips to make this campaign week possible. Financial oversight is maintained by the three signatories I mentioned: the president, the treasurer, and the financial secretary. There is no administrative overhead taken from investor contributions. Our ask from the Cameroon Town Hall community is tonight is support towards this amount, towards funding this gap for the 2026 campaign. We've already received a substantial amount in kind, and we know that obviously cash is not something that we can go without. In return, every investor will receive a name recognition on all our campaign materials, and in the final report, you receive real-time updates during the campaign week. We'll try to ameliorate on that, and of course, a post-campaign impact report showing you exactly where your investment went to. You're invited to virtually attend the campaign launch on August 9th, and of course, at the end, you will receive a certified letter of appreciation from the CAMESA executive, and most importantly, you would have directly contributed to the healthcare for over 1,500 people who would have nowhere else to turn. To make this concrete, your investment would exactly pay for medical supplies, the drugs, the consumables, the surgical materials that Ascovin will use, the lab reagents for over 1,500 patients. It will go also to personal support, towards our accommodation, the transport, and our feeding for the 7 days, to our final scout trip to prepare the community and obviously prevent waste, for laboratory reagents for the 6 categories of diagnosis screenings that we are going to do. It will go towards health education materials for community sessions like banners, the speakers, and all of that. And of course, towards an emergency contingency fund for unforeseen medical or logistic needs. Nothing that we're doing is abstract. Every single franc will have a destination, and every destination will have a face. So, I'd like to leave you with this. Your investment tonight is not a donation, it's a partnership. With over 100 medical professionals who are giving their expertise because they believe in this mission. With 1,500 patients who will receive care in August that they cannot get anywhere else. And with 30 years of an institution that has never ever stopped showing up. The ask is simple. You can pledge tonight. The funds will be transferred by July 2026 to allow the final logistics to be confirmed. And in September, a partnership made possible. 30 years ago, a group of students decided that being a medical student meant more than attending lectures. And tonight, you have the opportunity to honor that decision and to be part of what comes next. On behalf of the entire Kamesa family, the current students, the executive committee headed by the president, the whole campaign team, and the alumni across the world, I'd like to thank you. Thank you for your time tonight. Thank you for your belief in this mission, and thank you in advance for your partnership. Kamesa and I are open to answer any of your questions. I'm very grateful for your attention.
Wow, thank you very much, Lamuela. What an excellent presentation, eloquent presenter. I hope the minister will take you on one of his trips when he's going to do fundraising abroad, so you can speak this way and bring the money to Cameroon. And before we actually even comment, let me put the students on spotlight. Please, whoever is holding the camera, go let everybody say hello. You can unmute. We want to hear your voice. Unmute and let us hear you. Unmute your. Unmute. Yes, we want to hear the voices. You sent us the best of you to present. That was excellent. Thank you very much for being together for this presentation. Thank you for the wonderful work you've put together for this excellent presentation. I know it has been a teamwork for all of you. Yes, thank you so much. We are happy to see you all gathered in that room, and I hope you enjoyed the presentation. Thank you very much. And now is the time for me to get back to our guest of honor, the Minister of Health, to comment about this presentation. Mr. Minister, you've heard your students. this is the future you have. These are the people who become medical doctors, nurses, pharmacists, lab technicians, and this is how ambitious they are to transform the healthcare system of Cameroon. And now pass over the microphone to you for your comments about their presentation.
Merci beaucoup, Monsieur Elvis. Je voudrais remercier d'abord la Mola pour sa brillante présentation et derrière elle, tous les étudiants qui sont commis par la tâche et qui se sont donné cette mission de pouvoir apporter un sourire, n'est-ce pas, à nos communautés, à nos frères et sœurs qui ne peuvent pas avoir la possibilité, n'est-ce pas, de se soigner ou d'avoir accès à des soins de santé de qualité. Et donc, moi, j'ai suivi avec beaucoup d'attention. Je voudrais les encourager et leur dire que, comme je l'ai dit d'ailleurs dans mon propos liminaire, c'est eux l'avenir de la santé dans notre pays. Nous travaillons aujourd'hui, c'est pour simplement aménager l'espace pour que vous puissiez revenir, continuer ce que nous avons commencé avec la même détermination, avec le même engagement et la même confiance dans notre pays. Et donc, je voudrais leur dire merci pour ce que je viens de voir. Merci pour tout ce qu'ils ont déjà fait et merci pour ce qu'ils continuent à faire. J'ai hâte, comme vous l'avez dit, de travailler avec elle, puisqu'elle elle est très éloquente, elle présente très bien. Je sens en elle une personne qui aime, n'est-ce pas, ce qu'elle fait. Et donc, je crois que quand elle sortira, j'ose espérer simplement qu'on pourrait la voir rapidement à nos côtés pour pouvoir travailler et changer le système de santé de ce pays. Maintenant, j'ai vu pour l'activité qui est en train de se faire, j'ai vu le budget qui est présenté et je ne peux pas aussi voir tout cela et rester calme, et rester tranquille et sensible. Donc, je promets à l'association des étudiants, pour ma contribution dans le cadre de cette campagne, 5 millions de francs pour qu'ils puissent rapidement boucler leur budget et avancer. Voilà.
Yes, this is amazing. This is amazing. You can see all the flowers, all the claps, and all. Please, you can open your video and thank the minister. Let him see your face. If you are attending the town hall, please
Amazing,
open your
Mr.
video.
Minister.
We want to see,
Amazing,
we want to see
amazing.
your videos. Open your
So
videos.
much
If you are
success.
creating your videos, this is the time for you to open your video and say thank you to His Excellency. This is his personal contribution to this initiative, not as minister, but as his humble self. And this is really exemplary. We want to thank you so much for this really wonderful way of encouraging your students. It's really, really great. Thank you for your appreciation. And of course, for the Innovation Award, which you promised that is going to start next year. This is a very important award, which will encourage all the different associations. I think we don't only have the English Speaking Association, we also have other student associations that are doing different work. And so this Innovation Award will really help to encourage this kind of community-led work. Primary healthcare preventions are all powered by this kind of initiative. And the minister has also been a lover of community outreach campaign. I remember in 2025, he led very huge outreach campaign in the far north region, in the southwest region, in the east regions, where thousands of people were mobilized to receive healthcare free of charge. And so you have been a champion of community outreach program, and I'm sure that's why you're passionate about what these students are doing. Muno, before I come to you and Brian to comment about the presentation, we also have our own father in the house, Dr. Mark Forby, who is a regular and he knows what this means. And I want him to just say a word or two to the students and to the minister.
Hello, thank you, my colleagues. A very interesting presentation. I'm very encouraged by the new generation. And I want you to know the older ones like us are out there to support you. I want to thank the minister for his support for this work. And I'm not going to say much because I think it's a great job and I think you're going to continue it. I'll pledge about 500,000 francs towards your next trip in August. And that's all I'm going to say today. God bless you all and stay strong.
Thank you so much. Thank you so much. For those who don't know him, please just look at the name and Google it, and you know who he is in the healthcare community, both in Cameroon and internationally. Thank you for always being a member of the town hall. We're really proud to have you as our mentor. Right
Thank you.
now, I want to get back to the co-moderators. Dr. Brian, I would like you to comment before I hand it over to our chair. And of course, those who are attending, get ready. We're going to open the floor for pledges.
No, Elvis, before you go, I think a lot of the students may not know Professor Mafobi. He is the pioneer of what you call the pediatric surgery in the world, and he created the Forbes pouch. So, for those who have not, he's been a leader in the US for surgeons. He's been a strong leader in our community as Cameroonian physicians and has been help to us and also to Cameroon and the diaspora overall. So he's one of the most recognized physicians in the US. And we are grateful to have him here and to always be part of our community as doctors in the US. He's a pillar. He's actually the pillar which we stand on. So I just wanted to say that to the young generation so you can always get inspired. Thank you.
Thank you so much, Mona. Thank you. Brian, over to you.
Yeah, I just want to anchor on that there are a lot of health, just like Dr. Malfobi, who have done significant contributions to healthcare in the diaspora that the Cameroon Medical Students Association, the students should get in touch with. I think there's a lot of expertise that you can all tap into. And when you graduate from school, you can benefit from mentorship, from guidance, from whether it's in research, whether it's in residency, whether it's in whatever career trajectory you choose to path, just know that the Cameroon Town Hall is available, and you should always reach out whenever you have a need for assistance in anything. Over.
Yeah.
Over to you, Dr. Mona, for your comments before we
And
open.
Brian, not to forget, I think the founding father of CAMESA is, he may not even remember, but right now is Professor Alan Tita. He's our chair in ACPA. He's the founding father of CAMESA. If you guys read your history, I think I read that. And there are a lot of people who are out here who are willing to help students. I used to be part of multiple organizations and multiple associations. And when we were in charge, we did do a health campaign in Pinyin, in Buti, in Dapang, in Moi. I can still remember those villages that we went to. We also did a health campaign back in Bimbia, which never is found in the report, but that was one of the biggest campaigns we did in our time. We had the support of the late Njalakwan, who gave us a lot of support at the time for us to be able to do that as medical students in 2002. So there were a lot of we are happy to see that you guys are still going strong and all the other organizations and associations that are found in the faculty. So Elvis, for the town hall itself, we're going to give them maybe $1 million from the town hall in order to help them. Last year, we did have an excellent report from the students, an excellent report. And the director of child was the one who reached out to us, Dr. Yauba, who is also a big partner and supporter of the students associations that are found in the Faculty of Medicine. And we got a report, and I was very pleased with the report, and I was pleased with the level of details and accountability for every single money that was given to them. So this year, Elvis, on behalf of the town hall, I'm going to pledge $1 million for these students and add to what our minister has done. And we are truly grateful that the minister surprised us, because this was, if I had published that the minister was coming, you would have had almost hundreds of thousands of people attending the town hall today. So this was a big, I'll call it July or June surprise. So thank you, Mr. Minister, for coming. And also, I just want to say you are a supporter of health and a supporter of public health. And recently, when ACPA was in Cameroon for a cancer screening program in the Boya, which we'll be sending the report to you. We're presenting the report. Our president will be coming over to the ministry, and we'll present the report of what was done by ACPA. And you were a supporter from the beginning. You heard about the project. There in Boya, we screened more than 2,000 patients for different cancers. And we're working on now creating or working with the ministry in order to support the Comité National de Lutte contre le Cancer for us to have guidelines. We'll propose some guidelines in place which the ministry has technical teams that would work on. Those are things we're doing. We're also working on trying to see how we can work on the National Cancer Registry, part of our team, getting research fundings, which we are working on. We are also working on seeing how we can harmonize tumor boards to be done throughout the territory of Cameroon, and we'll be sending that report over to your team to assist you, and so you can have a team that would work on that. So those are all things that I want to highlight, and we want to thank you very much for within a month when we reached out to you, you were fully engaged, and you did send your permanent secretary to Boya. We have not had the opportunity to thank you for that. And so thank you very much, Kamesa Hoye.
Yes, it's really Kamesa Oye, and we are really fired up. We are really fired up. I'm very proud of my boss. You see, he's promised 1 million on behalf of the town hall. I have a good boss. Thank you very much, Dr. Mono. You are a great guy. Great leadership. You've held this team together for a long time. Now I'm opening the floor to those who want to pledge. And if you want to pledge, just show your hand up using the icon and let us know your contribution you want to give to the CAMESA health campaign, but also a vote of thanks you want to give to his minister for honoring this town hall today. I would want to, while I wait, okay, Emmanuel Nanje is here. Emmanuel Nanje is right from Texas. Hello, Emmanuel.
Hey, Elvis. Georgia, yeah.
Oh, Georgia, sorry, I missed it.
Yeah.
So
actually, I'll pledge anonymous and I'll send my little token to you. So you know what we do.
Great.
Thank you for the great job that you and Dr. Mona you've been doing.
Thank you very much. And you're a silent supporter of the town hall. Whatever support he sent, Kamesa, you get it. Thank you very much. We have Kenji is up. Kenji, Dr. Kenji is here.
Yeah, thank you so much. What a great presentation on the impact of what you're doing. You know, not to talk much, I'm pledging 500,000 towards the campaign. I'm going to send it directly to the town hall immediately after this meeting. So good job. And I'm also pledging my availability for any technical expertise when it comes to anything laboratory related. If you need any help or anything, just feel free to reach out. Thanks.
Thank you, Dr. Kenji. Dr. Kenji is a regular in the town hall, one of the best in the field of medical laboratory diagnosis in the world. He is in one of the top hospitals in America, Stanford Health, and he's a director of lab in that institution. We are very proud to have a Cameroonian at that level. Thank you, Dr. Kenji. Now the floor is open. I know Dr. Theodore, I was planning on calling you, but I knew your hand was going to be up. One of our regulars in the town hall, Dr. Theodore, Professor Theodore has a medical practice in Cameroon. He's contributing directly to the healthcare system in Cameroon with a very beautiful medical facility in Douala. He's from the UK, spent his entire life practicing in the UK, but decided to move to Cameroon to directly contribute to the healthcare system in Cameroon. Professor Theodore, over to you.
Thanks, Dr. Elvis, and my utmost regards to the minister and to his team. I think he has together with him Professor Sobwi and Dr. Fokam. I would like to say regarding what the minister was saying, you know, when the minister mentioned universal health care in Cameroon, it struck a chord with me because I think it forms the basis of providing the health care that Cameroon needs. And I think there's one important thing, Dr. Sobwi said it, they've increased the access to healthcare, that over 80% of Cameroon population is within an hour from a healthcare district. Now, people don't actually realize, but that is the foundation of universal health coverage. The foundation is actually getting healthcare closer to where it is needed. And there are three axes in achieving universal health coverage. And it's actually who gets the healthcare, what is covered, and how much is being covered. And bringing that healthcare closer to people actually provides that equity that we are all looking in healthcare. And I think that is something we have to applaud the minister and the Cameroon government for achieving. We are always based on trying to look at the negative things, but there are lots of positive things that are happening. And unfortunately, they are very little things. And by the time we realize, a big shift has actually happened. Now, we talked about having equipment throughout the country, the 10 regions of the country. They have modern hospitals that are being equipped. It's true. Now, the minister says the Cameroonian diaspora should actually support this endeavor. And you can see from the town hall how many Cameroonians in the diaspora are actually keen to support this endeavor. I think one important thing that we need to do is on the propaganda side. We need to inform the diaspora that Cameroon is not against them. They need to come and join forces to actually make things happen in Cameroon. Things can happen in Cameroon. Yes, of course, we all have negative experiences, but there are many positive experiences. I would like to thank the minister for presenting some of those positive experiences, but I would like to encourage every other person to actually highlight those positive experiences. Muno and all those who participated in the cancer awareness campaign, we saw what happened in Boya. We saw what happened in Boya. To me, that was a positive experience. Unfortunately, there are some little pockets of things that are negative. And I think we need to highlight what was positive for those negatives to become insignificant. We are today praising CAMESA for eloquent presentation and the work they've done over the years. Now, the alumni of CAMESA are the Cameroonians who are heading departments all over the world. Those people can still come back to Cameroon and contribute. Their contribution can help in improving what we are trying to do in Cameroon. Some of us, yes, we'll spend our time in Europe. We are back in Cameroon trying to make that contribution. There are loads of other people who can actually support. There's a platform in the Ministry of Health where people can come on and express how they can support the country or even talk to people. I think that is very important. Now, CAMESA, you're doing a fantastic job, and I'm glad that the job that you're doing is not a one-off. A lot of people do medical campaigns to Cameroon and do one-off activities. But I'm glad that your activity is not a one-off. I will encourage you people to actually, in addition to doing those one-off things, try to set up a follow-up on those people who actually had medical management, because there is nothing worse as half treating somebody. So if you find somebody who is ill, set up a follow-up plan for that person. If that is not included in your practice, include that in your practice. Make sure that that person has a follow-up. Okay. Now, with regards to what we're talking about, the follow-up, now I will pledge Premier Health Center will provide follow-up to anybody who has a GI condition, and we will provide that free of charge if they come signed by CAMESA. To support your mission, I personally will contribute 100,000 francs to your mission. And I'd like to thank all of you for giving me this opportunity.
Thank you very much, Professor. You're always very inspiring, always very, really, actionable in your approach. Not only has he donated 100,000, but he has opened his facility in Douala for any of the patients you will find on the field that needs a GI procedure that can be handled at his facility, referred by CAMESA. That person will benefit from that service free of charge. That is an enormous gift. Thank you so much.
Let me add something. During our last campaign that we did there was a lot of support from the town hall, but from ACPAR, Professor Ngatri was there, and he did provide follow-up to all those who had positive tests, fecal or cord blood, and was part of the team, and even the surgical interventions and the endoscopic procedures that had to be done. So I really want to recognize him for always being part. He's part of CamDoc UK, but he joined us when we came from ACPA from the US, and he was a total integrated part of our mission in Cameroon. We call it a fact-finding mission, which was a very good fact-finding. We found out that everyone wants to collaborate with us, and we found out how good the physicians and also the team was out there. So thank you. Just adding that.
No, thank you very much, Dr. Mono. And we have Dr. Samuel, who is one of those representing the diaspora, the Cameroon Town Hall, in the special commission that was created by the Minister of Health in the Ministry of Health to facilitate all diaspora investment in Cameroon. That committee has done a lot of work, and thanks to the presence of Dr. Samuel as a member representing the town hall and the diaspora in the interministerial committee that had both people from the Ministry of Public Health, External Relations and Finance to see how any diaspora investment in the health sector can be facilitated in Cameroon. So if you're planning to open a medical hospital, a clinic or a laboratory, or maybe sending equipment in Cameroon, there is a structure in place in the Ministry of Health that is there to facilitate such initiatives. So Samuel has been there. Samuel also has a practice in Cameroon. He owns a clinic in Dop that is providing healthcare to those people in last mile communities and those underserved communities. And he wants to also pledge and also say a vote of thanks. Over to you, Dr. Samuel.
Thank you very much, Elvis. Thank you. And I want to take this time again to appreciate the minister. He has really been very supportive for us in the town hall. I want to again remember that yes, in the town hall, we always say yes, it is slow, just like Dr. Ngachu, Professor Ngachu just said. I am very, very impressed that we have a minister who is thinking about tomorrow. The CAMESA, the students, they are the future healthcare professional in Cameroon. And seeing what the minister has done, I just wanted to say thank you, Your Excellency. It touches my heart because for 15 years, I have been right at the grassroots. And I understand what the students are going through because I have been with them in the Northwest, I've been with them in Yaoundé. And we have said a lot already, and I just wanted to start by saying that Professor Ngachu already mentioned one of the things that made us with Faith Goddess Medical Foundation to get to the minister, and I want to thank him again for the authorization to open a clinic, was because of follow-up. We have been doing medical missions for 15 years, and follow-up is key when we come and see them and leave. What happened to them? And I can also see that in the presentation, the excellent presentation, they mentioned about working with the district medical officer, which is really great, making sure that when they're leaving, those patients, they have a place to go. So today, I am coming to say, Kamesa, you have a partner. I am first of all starting by pledging that my team will be your partner moving forward. That is the first commitment I will make, and to also say it is early for the town hall. We have been working on a clinic at the outskirts of Yaoundé in Awai, which is called Awai Village. And of course, many of you students will need internship. So the second support will be that we have a container that will be coming, and in your campaign coming up, you should connect with me and you will have a lot of medical supplies that will be in that container that will help you for your next campaign. And we also have I am in cardiology, we have an ECG machine that we will offer you guys so that you will be able, for those of you learning, you will have an electrocardiogram machine that you can actually use in school. So that one is already in Yaoundé, and I will be in Yaoundé in July, this July, and I will personally hand it over to your representative. I also placed 100,000 francs CFA to support the work that you are doing, because being the one in the field, I know how important it is. Transportation from one area to another is very, very challenging. And I want to again thank you for the work that you are doing, and that you should continue the work, and trust that the town hall, in collaboration with the ministry and also with our working group, I believe that we now have a channel, and even to many of my colleagues and many of us in diaspora who wants to support, as Professor Ngachu is saying, now we can no more complain that we don't know where to go in Cameroon to do a medical mission. Kamesa is already on the ground. Just like the chair of the town hall, we say that we should not reinvent the wheel. So we already have the support. And now we can use the proper channel through the ministry, and we'll be able to do a lot of work. So in the near future, you will be seeing me in Cameroon, and we are coming to launch our second clinic. Congratulations for the work that you are doing, and keep up with the great work. Thank you.
Thank you very much, and we appreciate your gift. He's promised an EKG machine for the student. He's promised his facility, and he's contributed 100,000. Now, there are so many people who want to contribute. Please, if you take the microphone, just spend the first 5 seconds, say what you wanted to say, and then we move forward so we can get many more people who want to contribute. So please.
Elvis, can Dr. Samuel just talk a little bit about the working group?
In another session, so that
Yes,
we can
okay.
get another, because we want to gain time so Kamesa can get the best use of this. Samuel is a regular in the town hall. He's been saying this to us. Your chair, please, if we can give the Kamesa people opportunity for this. Let's get the next person who wants to say something. I have on my Brian, do you have the next person? I'm trying to get.
Yeah, we wanted to just, Dr. Foka mentioned he has a personal testimony for the students, since he's a lecturer of the Faculty of Health Sciences as well. Dr. Fokan, please.
Yes, Dr. Fokan.
Yes, thank you very much, Dr. Brian, and Big Brother, Dr. Tansi, for giving me the floor again. I just want to give a little testimony as a lecturer at the Faculty of Health Science, University of Boya. I mean, I was recently transferred to Yaoundé, thanks to the Minister of Health for office duties. But I really want to testify how CAMESA has been contributing in the life of the Faculty of Health Science at the University of Boya. We also have UBAMELs, we also have other associations, but CAMESA has been very transformative in terms of improving communication, improving community awareness, improving also the importance of adherence to health policy within the entire Southwest region. Despite the current socio-political situation, which is getting better, CAMESA really has been able to go down in the various community outreaches, and they have been very contributive to improve the quality of life within the region. So I also want to thank the Minister of Health for this very huge support, and then also advise CAMESA to take it very serious, the new initiative in terms of community award. This award, whenever the minister announces an award, he always makes it effective. The minister has been doing many awards within the Ministry of Public Health and even beyond. As a matter of fact, even for us in the major health program, we have been receiving awards from the Minister of Health, but this must be on a competitive and a merit-based approach. So we really want to encourage our students for them to be fully committed more and more. And we hope with CAMESA, Cameroon is going to move forward with his healthcare agenda under the Minister of Health. And I will end up here by saying we really believe this surprising outing of the minister will also serve as an encouraging tool. I'm pretty sure if the dean If the Dean of the Faculty of Health Science was aware, Professor Hale, he will have also joined this particular call to give us also his own word of appreciation. So without being mandated, I really want to also say thank you, Mr. Minister, on behalf of the lecturers and the entire faculty board of the University of Boya. We really hope this will set as an example to also encourage other faculty associations in other universities so that Cameroon will really gain maximum health benefit. Thank you, and over.
Thank you.
Thank you so much, Dr. Fokam. I think we'll take one last hand and then we'll try to round up. Dr. Sidney, please.
Yeah, hello, Town Hall. I really want to take this opportunity to be grateful and to specifically thank the minister. I remember 4 years ago when I came to Cameroon, I met the minister in his office and I told him about the project we are doing. I'm Sidney Taze. I'm the CEO of Clear Radiology Boya. And the minister promised that he was going to be there to ensure that the project got started and it got open. And I would like to report to the minister that we are live and open in Boya. And we've worked with ACPA and we've had a lot of success in community outreach and really changing the way medicine is the way people think about medicine in Cameroon. So, Your Excellency, I really want to say I'm grateful for all the help you gave us. I would like to extend my support to CAMESA. And right at this point, I will definitely be putting my institution at the disposal of the students of CAMESA. The good thing about Clear Radiology is that we are literally located right next to the University of Boya at the Faculty of Health Science. And we are already having students come here and they're doing rotations at the facility. And so I would like to promise that I'll put my clinic at the disposal for CAMESA. We're going to try to get students to come here and intern and impart that knowledge that through our cooperation with many professionals in the US, we've been able to achieve. We continue to do screenings and sensitization, and I'm so proud of all the work that the University of Boya students who we've worked with in the past, the medical students, how much difference and impact we're making in Cameroon. So, Your Excellency, thank you very much, and we continue to be in cooperation with Dr. Jinjakat and all the others that are on this town hall. Without this town hall, we would not be here today. So, Mr. Minister, this is really a testament to the work that all of us that we're doing together, how we can move healthcare in Cameroon forward. And I'm at your disposal. And once again, thank you. And I'll personally also pledge personal support for 200,000 francs to CAMESA to continue to support the efforts that they are doing in Cameroon.
Great. Thank you very much, Sydney, and thank you for taking your investment to Cameroon. When the medical doctors in America went to do their work in Boya, your facility was one of the really pivotal in that exercise. So thank you for all the hard work. At this point in time, we have Jacob Kwan. Your hand is up.
Thank you, Elvis, and the rest of the town hall leaders. I really want to appreciate the work that the medical students have been doing over the years. Personally, I've been involved in outreach, and it may interest us to know that in many communities, when you go for outreach, you will find people who have never taken a blood pressure. I mean, only a blood pressure for the past 5 years. And many of them are hypertensive and they don't know. And we know the prevalence of NCD even in local areas this time around. So I really see the value of this campaign beyond what they will do, because when they go out, at least the people will be sensitized to know that they need to at least undergo basic health check. And from this experience, some of them might engage to be doing their health check regularly. So it is a very, very important campaign. I also want to say that, interestingly,
yeah, we lost him. I'm sure he's going to be back. I'm sure he has some network glitches. We are wrapping up, and the minister will be giving a closing remark for this session soon. We've kept him over. It's not easy to keep him on his precious weekend for more than 2 hours. It's just to show how much he cares for us. And so at this time, I think, Dr. Muno, I would want us to maybe let me give the floor to Brian, first of all, your closing remark, and to the chair with your closing remark. Then once the minister closes, we end the session. So Brian, some last words from you.
No, thank you. Thank you so much, Elvis. It's really been a great honor, and thanks a lot, Your Excellency. We are deeply, deeply, deeply grateful. And again, to the students, again, just like Dr. Kenji said, we are also available to provide any technical expertise that you need, not just for the health campaign, but also for the future and any kinds of supports that you need throughout your journey. We are available. Please reach out to us. And thanks. Over.
Thank you, Brian, and thank you for always being there at the service of the Cameroon Town Hall for Healthcare Professionals. You are a mentor to so many other medical students and healthcare professionals. Brian is a really, really big, respected public health expert who has served the CDC in Missouri State during COVID. He helped in so many states in Cameroon, here in the United States during COVID in surveillance, genetic sequencing. He's a trusted expert across different parts of the world when it comes to genetic sequencing, and now AI expert. He's written a lot of code for Anthropic and OpenAI. He's a highly respected person, Brian, as you see him there. So I don't want to blow his flowers a lot, but we are so proud to have you, your humble self, always at the service of the town hall. Mona, over to you for your last words.
Yeah, thank you, Elvis. Yeah. Brian is small but strong. A lot of people may not know that. Brian was at the core of the US system in fighting COVID and preventing COVID, was in charge of sequencing. Most of people don't know. And I did see your multiple mentors, Professor Leke. They're very proud of you. And Brian is at the center of AI and at the core of a lot of things that you see in medical AI when you quarrel the system. So Brian is at the back of creating that system. So for those who don't know, so Elvis, thank you. And I would love to say that, today to me, the minister being here, he's been our collaborator and coming to the town hall, but to me, it was a surprise. And it was a lovely surprise because he has been one leader who has been open and has been coming to talk to the people, both the healthcare professionals at home and those in the diaspora. He's been in our town hall 4 times. This is the 4th time, and has answered every question without any filters. Those who had their concerns, we sent them over to him and he was able to address them. I want to thank him. Multiple diasporans have had projects which they wanted to do and they were skeptical. We do have people who are beneficiaries of that, and it led to those facilities that were needed being opened in Cameroon. We also have had situations where we started the discussion of creating a working group in the Ministry of Public Health, where the diaspora will be able to channel their projects through that working group. And that is an ongoing project, which we do have happening. And recently we're in Boya for a partnership with the community, first of all, the ministry, and we had an amazing welcome by the governor, also by the delegate, and also by the representative of the minister who was there, and not forgetting the university and the vice chancellor. We did have an impact, but that would not have been possible without the support of the ministry. And we are going to continue working with the ministry in terms of the town hall. The town hall started about 5 years ago because of COVID pandemic. We were scared and worried that Cameroon was going to be hit, but at the time the leadership did a lot and Cameroon was one of the least hit countries, but it has sustained the town hall over time. And we have been able to discuss multiple healthcare issues in Cameroon. Our last session was on mental health. which we had Dr. Bibi Kele, who spoke about mental health. And I think that's still a big problem in Africa that we need to address. And we are going to continue this collaboration. And I would love to use this opportunity. I know behind the scene, ACPA will be sending, our president will be in Cameroon next month. And she would love to see you and present to you all the report of what we did and future planning and collaborations. To the medical students, you are the leaders of today. I don't want to say tomorrow. You're going to drive care in Cameroon. You will drive policy. Today you chose Dr. Chen, who was an eloquent representation of what we think you guys can do. So she did an excellent job. I was very proud of your slides. I was proud of the way you did present. And I think your teachers will be proud of you. Many of your teachers are here. So there is Dr. Fokam is here, Professor Sobgui, who was also my teacher. He may not remember, but he taught all of us. So it's an amazing thing to see that the students are actually leaders. And do not underestimate the impact you can create. CAMESA is just one of the organizations. There are multiple organizations. And as the minister said, you guys had the privilege of coming to the town hall and talking, but you guys need to be able to continue and be sustainable so that you can be able to win the minister's award, which he's going to be putting out there. It's going to be a pride to see that you guys compete with the others and be able to show that you're truly the shining stars that you guys want to be. And I think it should be a goal moving forward. Please, Professor Gatry talked about something very important, sustainability. Every project that is done, if it's not sustainable at times, it's not worth doing it. The pillar which we created when we're in CAMESA and you guys refined is always working with the district medical officer. Going in, identifying the health structure in place, the CMRs, the district hospitals, the district medical officers, the delegates, and before moving in, you have to have that relationship that is going to be sustained. That's the same thing we did when we left Accra and came to Boya. We worked with the governor, we worked with the delegate, we worked with the director of the hospital in Boya. All patients that were screened were actually followed up back in Boya Regional Hospital. The Boya Regional Hospital practically did the screening for us. We actually reinforced their capacity. We were there with our
you might want to wrap up.
So thank you. We're there with the oncology surgeons and actually passed across capacity. So capacity building and sustainability is very important. I really want to say this because I am not an advocate of parachuting, where you come to a community, you do something, and then you leave, and then nobody can sustain it. So thank you very much, Elvis. And thank you, Professor Subway, for being here. A lot of us do know you very well. And thank you, His Excellency, for your time, your commitment, and thanks for the surprise, and thanks for always being willing to join us to discuss healthcare, and to also thank you for committing your personal fundings to help these students. And we would love to really say thank you.
And thank you very much, our chair. Thank you for your leadership. Thank you for all you do for the Cameroonian communities here in America and back in Cameroon. Now is the time for us to hand over to His Excellency, the Minister of Health, Dr. Manawuda Malachi, to say his closing remarks to CAMESA and to all the diasporans and those back home for this session. This is the 132nd session of the Cameroon Town Hall for Healthcare Professionals.
So I would like to thank you all for your kind words, but even more so for your encouragement, because I mean, the Cameroon government is committed to go forward. So I trust that it's together that we must build this country. I fully agree with the what Professor Ngachu said about our desire to move forward and faster, but not just a Cameroonian who is in Cameroon. but with the diaspora. We should together with all you, starting with the diaspora to make projects to make Cameroon going forward and transforming our health system. So I think for your project, I remain open and I can help you to run this project. To our medical student, I want to say I'm very proud. Proud for what you have done and what you seem to do in the future. Allow me to conclude this session with my convictions. So I think hospitals treat disease, but communities build health. And those who choose to serve these communities with competence, compassion, and integrity are the true builders of tomorrow's Cameroon. And you, students, medical students, you are the builders of tomorrow's Cameroon. Continue to dream big, serve with humility, and innovate with excellence. The Ministry of Public Health will continue to stand by your side in supporting this new generation of health professionals who will help build a healthier, more resilient, and more prosperous Cameroon. So that is what I want to say at this end. Et en citant Cheikh Anta Diop, je voudrais dire que le meilleur investissement est celui qu'on fait sur l'homme. Et donc, je crois que nous avons fait le meilleur choix et je voudrais vous dire merci pour tout ce que vous avez dit ici. Je retiens votre engagement, votre conviction de pouvoir aider le système de santé camerounais et je suis très fier. Je peux vous dire aujourd'hui que je suis le ministre de la Santé le plus fier de ce que aujourd'hui je peux me vanter, c'est que nous sommes ensemble et nous allons continuer à bâtir notre système de santé ensemble parce que vous m'avez fait confiance, parce que vous continuez de me faire confiance et vous avez décidé de m'aider à aller en avant. Et je voudrais vous dire vraiment merci, merci du fond du cœur pour cela. Merci et que Dieu vous bénisse tous.
Thank you very much, Your Excellency. As we close today's town hall, I want to sincerely thank His Excellency for honoring us once again with his presence and encouragement. I also thank Kamesa for reminding us that the future of Cameroon's healthcare is already in motion through committed young professionals serving our communities today. To all our participants across diaspora and Cameroon, thank you for staying engaged. Let us leave this session with renewed commitment to mentorship, collaboration, and of course, bringing healthcare to the Cameroonian community. Thank you all for attending and have a nice weekend.